For well over a decade, the battle over the Affordable Care Act has been one of the biggest dramas in American politics. But what if we've been looking at it all wrong? Today, we're going to dig into a really fascinating analysis that reframes this entire conflict. It suggests this was never really about policy, but about a raw exercise in power.
Right? This is the question that's left so many people scratching their heads. Year after year, election after election, the promise was made with such confidence. Repeal and replace. And yet, a real, workable alternative just never showed up. The source we're looking at today argues this wasn't some kind of failure. It wasn't incompetence. It was the strategy. Let's break down exactly how that worked.
Okay, so to really get this, we have to start with that foundational promise, the one that basically defined this whole conflict. And we need to introduce a core concept.
The source calls this idea power psychology. Now, when you start looking at the war on the ACA through this lens, all the actions that seemed kind of chaotic or self-defeating, well, they suddenly look incredibly consistent. The goal isn't necessarily to govern better or to create good policy. The goal is to maintain control. Here's the core argument. The ACA was a massive threat because it made people less afraid. Think about it. When you're not absolutely terrified that one bad diagnosis will bankrupt your entire family, you become a lot harder to control. You're less dependent on your employer or on political figures just for your basic survival. And according to this analysis, that loss of leverage, that was something power just could not stand. So the phrase repeal and replace became this perfect political weapon. It sounded so strong, it promised a solution, but it was really an illusion. The source argues there was never meant to be a plan. Why? Because a real plan would mean admitting that people deserve health care, and that would shift the entire structure of power. You know what was way more useful? Permanent opposition. It builds incredible loyalty without that messy, complicated burden of actually delivering results. Now let's look at how this strategy really kicked into high gear, especially when Donald Trump brought his unique style to the White House. Oh, this is a classic, isn't it? Just listen to the words, so much better, beautiful. These are designed to trigger an emotional response. They're not policy details. Donald Trump absolutely mastered this art of using these huge, superlative words and vague threats to just occupy all the space without ever having to commit to a single concrete outcome. And this really gets to the heart of the source's point. The chaos wasn't a bug, it was a feature. All that spectacle acted like camouflage. As long as his supporters were totally invested in the fight, they wouldn't really notice, or maybe they just wouldn't care, that he was never, ever going to be judged on actual results. And here is where this whole theory slams into reality. A bipartisan group of lawmakers, Democrats and Republicans, actually tried to force a vote to extend ACA subsidies. But then Speaker Mike Johnson just shut it down. Not by winning a debate or an argument, but by twisting the process. He literally sent people home. He blocked amendments. Democracy was just quietly strangled by procedure. This quote from the source just says it all, doesn't it? It's a masterclass in power psychology. The outcome was already decided before the argument was even allowed to happen. So what happens? What are the real-world consequences when the main goal is just control, not care? This is where the analysis gets pretty chilling. According to the analyses that the source cites, this is the number of people who are at risk of losing their health coverage. I mean, that is a staggering number. It's not a statistic, it's millions of individual lives, families, futures, all on the line. And then came this word. When leaders started dismissing the crisis by saying it was only a certain number of people, well, the source argues that's the moment power showed its true hand. Human lives were being crunched down into a politically acceptable percentage. The source kind of lays out the equation like this. Things like public health funding, Medicaid for the poor, those were traded away. And what was gained in return? Tax cuts for billionaires, loyalty from corporations, and of course, continued political dominance. It frames this whole thing not as a failure of policy, but as the successful execution of a power strategy. But here's the twist. According to the source, a strategy that's built entirely on fear and control, eventually it starts to eat itself. Just think about it for a second. When you see the same pattern year after year after year, these promises without plans, these cuts without replacements, it stops being a mystery. The repetition hardens into a story that even power can't control anymore. It's like the mask becomes the face.
Now, this is a really fascinating psychological argument. The source claims that political power works best when it can aim our fear outward, at enemies, at outsiders, at chaos. But the Republican strategy on healthcare? It turned that fear inward. Now, people aren't just afraid of getting sick, they're afraid of being completely abandoned by their own system. And that kind of fear is deeply, deeply destabilizing for those in charge. Which leads us to this trap. It's a classic power paradox, a real checkmate. If Republicans extend the subsidies, they're basically admitting the ACA works. But if they let them expire, millions of people get hurt, and the blame is impossible to avoid. They're trapped by the very strategy that kept them in power for so long.
And that's really the bottom line of this entire analysis. By dismissing the suffering of millions, by making the machinery of power so obvious and so visible, the strategy crossed a critical line. It was an overreach that basically exposed the whole game.
So what did we learn here? That so often political battles aren't about policy, they're about power. That fear is an incredibly potent political tool, but man, it can also backfire. And that sometimes the most revealing thing a political party can do is nothing at all. Which leaves us with this final powerful question from the source. When a system chooses hierarchy over health, who is left to pay the price? That's a question we're thinking about long after this is over.